Chronic kidney disease is the 9th leading cause of death in the U.S., affecting about 35.5 million people. That's 1 in 7 adults. It's more common after age 45 and slightly more common in women than men. Many individuals are unaware of their condition until it reaches advanced stages. So in this video, we will take you through the major causes of chronic kidney disease so you can be aware, take action, and help reduce your risk of kidney damage. But before that, have you or someone you care about been affected by chronic kidney disease? If so, share your experiences in the comments, including any difficulties you encountered and how you overcame them. Toxins and environmental exposure. Exposure to heavy metals like aluminum, lead, and cadmium is a significant environmental risk factor for kidney health. Studies have shown that aluminum can impact thyroid gland function, which can have downstream effects on kidney health. Meanwhile, lead and cadmium, commonly found in polluted water and industrial environments, can directly harm kidney cells, leading to chronic kidney disease. Certain medicines and substances, like special dyes used in medical imaging, can be harmful to the kidneys. These substances can stop the kidneys from working properly, leading to a condition called acute kidney injury. These toxins can be a poison to the kidneys, and if we're not careful, they can cause lasting kidney damage. Recurrent urinary tract infections. When you get recurring urinary tract infections, it's like your kidneys are under attack. The bacteria from the infection can travel up to the kidneys and cause a severe infection called pyelonephritis. Recurrent UTIs can also cause inflammation and damage to the renal tubules and surrounding tissues. If you don't treat these infections promptly, or if they keep coming back, it can lead to kidney damage and scarring. This damage can build up over time and eventually lead to chronic kidney disease. Prolonged use of certain medications. Certain medicines used to treat common health conditions like diabetes and high blood pressure can have a dark side. These medicines can reduce kidney function, cause inflammation, and lead to kidney damage if taken for a long time. Some medicines can throw a wrench into how our kidneys work, messing with important processes like hormone balances, blood flow, and waste removal. This can cause a domino effect, leading to problems like excessive urination, dehydration, and a decline in the kidney's ability to filter waste. It's like these medicines can be a double-edged sword. They help treat one condition, but can hurt our kidneys at the same time. It usually makes harmful substances build up in the kidneys, making them work even harder and increasing the risk of chronic kidney disease. Mellitus. Diabetes, also known as diabetes mellitus, can be a major contributor to the development of chronic kidney disease. High blood sugar levels damage the kidney's tiny blood vessels and nerves, leading to problems with filtering of waste and excess fluids. Over time, this can cause the kidneys to become overworked and scarred, increasing the risk of kidney diseases. Diabetes triggers a chain reaction of kidney damage, known as diabetic nephropathy, which disrupts the kidney's structure and function. This damage causes proteins to seep into the urine, blood pressure to rise, and kidney function to drop, all of which are red flags for the development of chronic kidney disease. Diabetes can be like a slow-burning flame that gradually erodes the kidney's function, leading to chronic kidney disease. Alcoholism. Alcohol is a diuretic, which means it increases urine production and leads to dehydration. It hijacks the kidney's ability to regulate fluids by interfering with antidiuretic hormone signals, leading to a surge in urine production and thirst. This usually puts the kidneys under stress, forcing them to work overtime to keep up with the fluid imbalance. Alcohol takes a grip on kidney function by causing blood vessels to constrict and dehydration to set in. This can reduce the kidney's ability to filter waste and regulate fluids, leading to a buildup of toxins and an imbalance in fluid levels. Excessive alcohol consumption can also cause a buildup of minerals in the kidneys. These minerals can disrupt the proximal tubular function, tiny filters that help clean the blood. This leads to the formation of kidney stones and scarring of the kidneys. Diet. Another major cause of kidney disease that's mostly overlooked is diet. A diet high in sodium, mostly from fast foods and salty meals, can be a recipe for high blood pressure. which can damage your kidneys and increase your risk of chronic kidney disease. For individuals prone to kidney stones, consuming oxalate-rich foods like beets and berries can be like adding more fuel to fire, increasing the likelihood of stone formation. Meanwhile, the buildup of calcium phosphate salts can be the spark that sets the process in motion. Taking in a diet loaded with sugary treats and processed foods can pave the way for weight gain, insulin resistance, and a heightened risk of developing diabetes and high blood pressure. These conditions can then increase the likelihood of chronic kidney disease, triggering a series of health complications. Obesity. Obesity and high blood pressure are a dangerous combination that can harm the kidneys. Excess weight can lead to changes in blood flow and pressure, causing blood vessels to become narrow and stiff. This can damage the kidney's ability to filter and clean the blood, increasing the risk of chronic kidney disease. Carrying excess weight, particularly belly fat, can lead to type 2 diabetes and can severely damage the kidneys. As fat builds up, the body becomes less able to use insulin effectively, causing a spike in blood sugar levels. If left unchecked, this can lead to kidney damage and diabetic nephropathy, a serious condition that can progress to chronic kidney disease. When someone is obese, their kidneys are subject to high pressure and blood flow, which leads to wear and tear on the kidney's filtering units. Over time, this can cause the kidneys to deteriorate, leading to a higher risk of chronic kidney disease. Aging. Aging is natural, and as we get older, our kidneys naturally lose some of their tiny filtering units called nephrons. This means older adults have fewer healthy nephrons to remove waste and toxins from the blood, impairing the kidney's ability to work properly. With age, the kidneys may receive less oxygen and nutrients due to decreased blood flow caused by vascular changes. Aging does affect the body's ability to regulate blood pressure and fluid balance, potentially leading to hypertension and increased kidney workload. Aging can impair the body's ability to break down and remove medications, increasing the likelihood of drug-induced kidney problems and damage. High blood pressure. The kidneys are densely packed with blood vessels that work tirelessly to filter toxins from the blood. However, when blood pressure is too high for too long, it hurts these vessels and make them smaller. The kidneys then don't get enough blood, so they can't work right. High blood pressure can take a toll on blood vessels, causing them to become narrow and rigid. This can eventually disrupt the kidney's supply of vital oxygen and nutrients, leading to damage and potential failure. High blood pressure can injure the kidneys, leading to proteinuria, a condition where they leak too much protein into the urine. As this continues, it can cause more kidney damage and worsen kidney function. Kidney disease is a big challenge, but it's not impossible to overcome. If we work together and focus on kidney health, we can make a difference and create a brighter future. Let's take control, raise awareness, and move forward towards a world where kidney disease doesn't stop people from living life to the fullest. If you watched to the end, thanks for your engagement. Like and subscribe for more content. Check out our recent video on early liver cirrhosis symptoms you shouldn't ignore.